Hello, this is Marlena Corbett for a mandatory video assessment of a medication. I chose to do an antidepressant, specifically duloxetine. Duloxetine is an SSNRI, serotonin norepinephrine reuptake inhibitor. This medication is given in capsule, extended release, anywhere from starting of 20 to 30 milligrams. This medication is given basic for depression. There are a couple of symptoms that depression is, whether it is feeling of worthlessness and guilt, having issues with sleep and weight, whether it's increase or decrease of weight and sleep. You also can feel not interested in any activities of your daily life. You can have trouble concentrating. You can have changes in how you are able to view life in general. What I found interesting about duloxetine is that it's prescribed for people not only with depressed moods, but also people who are in pain, chronic pain like fibromyalgia and muscle and stiffness pain. Also people who have diagnosis of diabetic neuropathy. And I also read somewhere that it can be used for people who have osteoarthritis. An interesting fact that I researched was that you can use this medication for children as low as 7 years old. What this does is it takes the receptors have, they recycle the neurotransmitters of the chemicals of serotonin and norepinephrine. And because it inhibits that, it keeps them in the body more to help with the feelings of hopelessness, of guilt, of not being able to concentrate, of the depressed mood. And the other thing that I found interesting is it can take some of those, like the sleep and the appetite, it can help with those in about 1 to 2 weeks, whereas the depression of the mood and the feelings of guilt, it takes about the 6 to 8 weeks, which is common with antidepressants, to build up more of those neurotransmitters. So when I would talk to a patient about this medication, I would first make sure that I knew a little bit about them. I would make sure that I understood their willingness and their understanding. I would start by saying, "Hello, Mr. Smith. My name is Marlena Corbett. I am your nurse today, and I'm here to talk to you about the new medication, duloxetine. The doctor ordered you to start on 20 milligram capsule, and you can take it once a day in the morning with or without food. Now, there are going to be some side effects that you could possibly have. There's nausea, vomiting, diarrhea, and headache. The more serious one is hypotension. So when you feel like you're gonna get dizzy, you'd wanna stand up a little slower if you happen to get dizzy or get blurred vision. I would also make sure that I would talk to the patient about the medication that they're currently taking, because duloxetine can cause bleeding issues. I would make sure that they understood that they would want to stay away from things like aspirin and ibuprofen. I would encourage them to take Tylenol. And if they took warfarin or Coumadin, I would talk to the doctor about maybe prescribing a different antidepressant. I would also talk to them about how this works. I wouldn't use the words receptor because that's kind of a word that not everyone would know. I would give them an example of the telephone. How when you have one side and it goes to the next side, that's what dendrites are. And I would explain to them that the chemicals or the things in the body that you need, they can't get to the next one because the supply of them isn't available for whatever reason. It could be genetics, it could be the receptors that they have to get the chemicals. There's not enough of them, and that we want to create more to help with the depression and the feeling of hopelessness and the sleep that they're having. I would also talk to Mr. Smith about maybe possibly having therapy to give them more coping mechanisms besides the medication. I would refer him to a therapist within his network or within the clinic itself. How I would make sure that this patient is compliant is I would ask them to recall what we had talked about, what the medication is for, what are some of the signs and symptoms, and what are some of the serious things that they need to look out for, the hypotension and the bleeding. I would also encourage them, if they're having more depression or suicidal ideations, to call, so that way we can either have them come in, or we can change the medication, or we can refer them to a different help. One of the things that is really important in understanding how depression is to be supportive of this patient, making sure that they understand that this is not their fault and that this is something that we can do to help them. And that it may take a while, but again, duloxetine will help with some of those in that 1 to 2 week. And also to make a follow-up appointment, so that way in that 6 to 8 weeks, you can reaffirm the signs and symptoms, see how they're doing, if they need any changes. So thank you. Marlena Corbett's mandatory assessment in regards to medications.